back to Meds Made Easy. My name is Sharoon. Today we're going to be talking about Tamsulosin, also known as Flomax. It is for benign prostatic hyperplasia. Okay, so essentially this kind of naturally happens in a lot of men as you get older. Your prostate tends to inflame, causing pretty much you to have trouble peeing because your pipage essentially it's all just swollen. All the muscles are swollen, so it prevents you from being able to pee normally. So you'll always get the feeling that you need to pee a lot, but then when you pee, it just a little bit comes out, and it's just a very annoying thing to have happen. But most men, the older you get, it's just what happens. It's kind of like the process of getting old, unfortunately. So let's get into it. So how does it exactly work? It's an alpha 1A blocker. So in your prostate, you have more than 75% of the alpha receptors in there are the alpha 1A receptors. So by blocking them, what we do is we prevent them from inflaming up. So the smooth muscle is able to relax, and when the muscles are able to relax, you're able to pee freely. And that's kind of how it works. The urine input goes up because we're able to get your bladder to relax, and that's how we get it to all work. Now, you generally take it once a day, although I have seen it up to twice a day, but you generally only take it once a day. It's a long-lasting medication. If you are fasting, meaning you don't have a lot in your stomach, generally the medication peaks in about 4 to 5 hours. If you have food in your stomach or you take it with food, then about 6 to 7 hours is when you're going to see this medication peak. So generally take it once a day unless you have some sort of serious issue. Then I've seen doctors do it like twice a day. If you have renal liver issues, you really don't need to worry about this medication. It's a very safe, benign medication. It doesn't really interact with a lot of medications. It doesn't cause a lot of problems. So that's kind of a good thing. But make sure your doctors always are on the same page and they know what you're taking. Because a lot of people use poly doctors, a different amount of doctors, and neither of them know what the other one put them on. So make sure your job as a patient is to make sure all your doctors know exactly what you're taking so that they don't prescribe something that can interfere. Here's a list of side effects right here. Again, you're not going to see too many issues. Things like hypotension can happen because it's hitting alpha receptors. It does affect your cardiovascular system. So, it could affect your blood pressure, kind of drop it down low. So dizziness, headaches are things that are kind of common. Another thing that kind of tends to happen, and this is a very common side effect, is ejaculation failure. You have trouble ejaculating sperm. A lot of men tend to not like that. You still want to be able to be sexually active and things like that. So this medication can kind of hinder that. So if that happens, make sure you let your doctor know, and then they got to maybe try putting you on something else that'll work. If you don't want that side effect. Orthostatic hypotension, syncope. If you have heart failure, you're generally not on this medication because it can kind of mess, like I said, it can mess with your cardiovascular system because it's hitting those alpha receptors. So you kind of have to watch out for that, which your doctor should know. So they shouldn't even be putting you on this medication if you have heart failure or anything like that. But beyond that, a very easy medication. Again, I've never really had a single patient come to me and say that they have trouble with it. They all say it works really well for them. No complaints. I mean, at the end of the day, if you're able to pee freely, then it did its job. And so that's what we got. So guys, that's it. Leave comments, concerns down below. Hit subscribe. Let us know how we're doing with these videos. We just want to help. We'll see you next time on Meds Made Easy. Bye.